everyone, I'm Nikki Britton. I'm the health officer here at the Berrien County Health Department. I've got Dr. Lauren Hamill from Spectrum Health Lakeland here with me. We are eager to give you an update today. It's been about a week since we've done our last live video, so we want to give you some updates of what we've been up to, how things are progressing in our community. We know we've got people joining us as we go along. If you do have comments or questions, you can type those in the chat box as well. We'll do our best to respond to them at the end. But we do want to give you a couple of updates. So what are some of the things that we've been up to here at the Berrien County Health Department? One of our biggest activities and what we've been up to is contact tracing. So for all of the positive cases that we have in Berrien County, the Berrien County Health Department actually calls all of those confirmed cases. We get the list of close contacts, who they have been around during the period that they were symptomatic and 48 hours prior, because we know there is some risk of infection before symptom onset. And we talk with those people about their close contacts. We then call all those contacts and inquire about their health status, their symptoms, and if they are symptomatic, we inquire about their contacts as well. This has led to a reach of over 1,600 people so far, and it's really helping us get a better understanding of what's going on in the community. This method of contact tracing and understanding who's symptomatic and what infections might be resulting from the confirmed cases that we do have is going to be an important strategy for many months and is going to be an important part of recovery efforts, which we'll talk about a little bit later. But this is an important practice, so you may get a phone call from the health department. Please be aware we are not going to ask for your financial information or your social security information, anything like that. We'll be asking about symptoms and close contacts. We've also been doing a lot of work with our vulnerable populations here in Berrien County. We've been planning and have at standby an isolation or quarantine facility for people who are experiencing homelessness, transient living, or congregate settings who might need to be isolated and quarantined and are unable to do so in their own home. We've also been working with other long-term care facilities and congregate settings to understand what their risk is, what preventive measures they have in place, ensure they have all the appropriate resources and information they need. Some of these settings include shelters, jails, group homes, and we've been doing a lot of work around long-term care facilities as well. We know that nursing homes, adult foster care homes, other types of settings where some of our most vulnerable population live are particularly susceptible. There's been a lot of media across the country about how hard this is hitting nursing homes. We're continuing to work with nursing homes both on a responding to any positive cases that have happened, but also on a prevention standpoint. There is a team comprised of health department and Lakeland nurses that is going to these facilities, assuring proper infection control practices, and really making sure that they know what to do if and when the first confirmed case hits in their facility. We've also been continuing to work with our partners in our Emergency Operations Center. We do have unified command with Lakeland that's allowing our strategy to be in alignment. And we are receiving donations and facilitating PPE distribution to organizations that need it. We've also been doing some data analysis. You may have seen that there was some data that was released on our website yesterday as well as on our social media. And we have been presenting some information that is a little bit new now with these presumed positive cases. So a presumed positive is somebody who has all the symptoms of coronavirus and they have a link to somebody who is a confirmed positive case, but they themselves have not been tested. We know many people in Berrien County have been ill, have not been able to be tested for a wide variety of reasons, including the shortages of the test kits that we were experiencing, particularly in March, but continues to be a little bit of a limiting factor here. And we know that those individuals are likely to have had COVID-19, but just weren't able to be tested, and that represents important COVID activity in our community. So we're reporting on those cases. A couple of things that are important to note is that number that we put out there yesterday, 162 presumed positive cases, that encompasses all of the cases that we have identified since we started to have COVID activity and this contact tracing happening towards the end of March here in Berrien County. And so that number was not 162 people that we identified yesterday or this week. That does represent over time. We will begin adding to that number daily, so you'll be able to see how that number is increasing, primarily through our contact tracing who we're identifying. But we want to make sure you're clear on what that number represents. So if you want to see more information about our presumed positive cases or some other analysis that we've been able to do on the the confirmed and presumed positive COVID cases. We have more of that information on our website. You can also find it on our Facebook page as well. I do want to note that it's important that this information is going to change daily as we've been updating with the confirmed cases. We also have a map here, which this map is new yesterday as well, and it's showing some of the areas where we're seeing COVID activity from the confirmed and those presumed positive cases. So there's different shading associated with the different categories based on how many confirmed and presumed positive cases are out there. This map again will be updated daily. So I want to turn it over to Dr. Hamel and hear a little bit more about what's going on at Spectrum Health Lakeland.
Thank you very much, Nikki. It's been just amazing watching what your department's been doing just over the last week, and of course through this whole epidemic. Thank you so much for that. If you were paying attention, you would have noticed that I touched this hand to my glasses while Nikki was talking, and I didn't stop to sanitize my hand because I did not want to interfere with the attention. But I want you to know that I noticed that, and I'm going to sanitize my hands before I do anything else, so I'm not touching anything else or anybody else.
Yes, good
and
practice.
We want you to do the same, of course, as well. Well, there are a couple things that I could update from last week. Good news, Spectrum Health Lakeland did its first transfusion of convalescent plasma today. Now, that's a big step. We hope that's going to be a very beneficial treatment. It's a little early to know how beneficial, but there's some folks out there studying it. Convalescent serum is where you take a blood product from somebody who had COVID-19, tested positive, recovered, and then 14 days later we test them again and they're negative. At that point we assume they have antibodies or immunity, and then we take their plasma and give it to somebody that's sick as a way of helping to kind of boost their immune response and also probably blunt some of the inflammatory response that occurs. It's hard to do that. It's hard to find people in the right category, get them tested, match their blood types, and hook them up with a patient that needs it, but we're working hard to create the process to do that efficiently. Please stay tuned for that because it's going to be very important that our community that has been sick with this reach out to those that are still trying to recover and help them recover through the donation of plasma. So that's really, I believe, important news. Sadly, yesterday, we had an individual at Pine Ridge get rapidly sick, and we tested them for COVID-19, and they tested positive. We, of course, tested the caregiver that had been around that individual to see if that individual also had tested positive, and the folks that that caregiver and those patients had come in contact with. We now have a few positives from that were asymptomatic at the time. Now, I expect some of them will become symptomatic. As you know, nursing homes are hit the hardest with this. The care is so up close and personal. And the problem with this particular virus is you can transmit it before you have any clue that you're sick. We screen folks, of course, every day coming in, patients coming in, or caregivers coming into the institution, and know that they don't have symptoms, but you can pass that along before you have any symptoms at all. Doing all these things like keeping our hands clean and social distancing is incredibly important, and it dramatically lowers the risk, but it doesn't eliminate the risk. As you know, nursing homes around the country are struggling with trying to keep COVID-19 away from their residents, and of course, when they contact their residents, struggling to try to help those folks recover. We have a whole team doing that. The health department is also helping with that. We're going to do our best to try to keep the folks in that nursing home safe. We have cohorted the folks that have tested positive, of course, in their own area. Make sure they're isolated in their rooms. Of course, all common activity, dining, and those things were discontinued quite a while ago. We'll do everything we can to be helpful there, but boy, it's tough. You know, certainly keep nursing home patients and those caring for them in your prayers. This is a really tough struggle.
Yeah.
I think that's what I have to share.
Yeah, and similar to what you're sharing of going on at Pine Ridge, just want to give everybody an update. Similar actions are happening at Hallmark Living. I know that we released the information last week that there were some positive cases at Hallmark Living in Benton Harbor as well. There's a lot of great things going on there, good practices to try to slow that spread. The thing that's tricky about these nursing homes is when you do see the cases and you do see symptoms develop, that is a signal of what happened a week, 10 days, maybe even 14 days ago. So it is expected that once you start to see signs, we will likely see a few more cases because we're not through all of the things that had happened previously. We are continuing to monitor these facilities, the residents and staff of these facilities, to assure that everything possible is being done to slow and stop transmission in these facilities.
You know, Nikki, one of the things I appreciate about our community, and I think unlike other communities, we're working together and we're talking about it. Openly and trying to help each other, not only between the health department and Spectrum Health Lakeland, but also among the nursing homes. I really appreciate that spirit of collaboration. I think it's going to be hopefully helpful in preventing additional cases and spread.
Absolutely. I think that collaboration is really important, and that collaboration is going to become increasingly important as we move towards recovery. And there's lots of questions right now of just when are things going to start to go back to normal, and how will things start to go back to normal. We know that it's not going to be as easy as flipping a switch. We're not just going to turn things back on, everything's going to go back to normal. But we do know that we are going to need social distancing to go through some different phases. Social distancing remains really important, and it's going to be important what those orders are and what that looks like. We expect to change over the next few weeks. We're not really sure what May is going to look like, but there are some efforts at both the federal and region level in our country. The Midwest governors of about 10 to 12 states have gotten together and started talking about how to take a regional approach for reopening things. And these are things that we've been planning for locally too, of what does that look like here, what measures do we need to have in place. We're monitoring the data to see how, if we meet some of those criteria, because one of the criteria that needs to be met before we can do reopening is to have fairly stable level and decreasing stable level of new confirmed cases and hospitalizations. So we're continuing to monitor that data, understand when we get there and when we might be able to roll back some of the restrictions that are currently in place while maintaining social distancing. Maintaining social distancing while businesses reopen is going to be really important. We've got a lot of local partners that are putting their effort and resources into understanding how that works, because we know based on the number of cases we have right now, we are not going to be at levels of herd immunity by the time we start walking back some of those restrictions. And so how do we continue to keep ourselves safe while reopening up sections of the economy so that we have all of those other really important things like jobs and being able to go outside and the social connection. We know those are really good for health too. So how do we balance those things? So those are things that we are thinking about. It's important to have those on the horizon. We're not there at that point where that's going to be happening here in Berrien County in the next week or two. We don't know at all what May is going to look like from a state perspective, but please know that we're planning and considering for these things.
So one of the things that Nikki just talked about, and you probably caught this, is this term herd immunity. You know, that may be something that you're real familiar with, but basically that's when enough of us have had the infection and have antibodies that it slows down the spread and that epidemic goes away. We know one of the things that might be useful in helping with that herd immunity as a health system is to have a good way to test for antibodies. Something called serology. Right now our testing is limited to something called RNA PCR, which is just a fancy term that says we're testing for the virus and see if the virus is present. And we're able to do that. We're also able to do that now in a rapid fashion within a few minutes. That's very helpful to see if somebody's sick right now. But if somebody was sick 2 months ago and they never got tested, that test is no longer of any value. What you need to be able to do is test for the antibody. We have purchased the equipment necessary to do those kinds of tests, and we're actively pursuing the reagents. The challenge, you probably all heard about these antibody tests and wonder, why doesn't everybody have them? Well, like everything else, they're now in short supply. But in addition, they're all new. And so just the accuracy of those tests is still it's being worked out. We can tell you with a great degree of sensitivity, do you have an antibody in your blood against coronavirus? It's a little harder right now to say, yes, but is that the right coronavirus? That's to the specificity of that test. So we might say you're immune and you're not be. And of course, that's a problem. You don't want to tell somebody you're immune, have them moving into a situation where they may be at risk, including in healthcare, and find out, in fact, they weren't immune. So we're looking at all the tests possible and trying to make sure we stand up the capability here to help for our community measure antibodies. I'm guessing that's a few weeks away, and I believe going back to work is going to be enhanced or maybe even dependent on being able to test safely for that herd immunity that you described.
Absolutely. So lots of unknowns still out there, but we want you to know that we are planning for this. We are trying to make sure we get there as soon as possible. However, it is important to reiterate, we're not there yet, and we do still need social distancing. We do still have the stay home, stay safe order in effect. That means that people should only be leaving their homes for very essential reasons, and only essential workers are reporting to work. We need to make sure that we maintain those measures, and again, good hand hygiene, avoid touching your face. If you do find that you've touched your face, immediately wash your hands, and so that you reduce your risk of infection. Do we have any questions?
If somebody does find out that they have had the virus, does that make them immune, and for how long?
Well, we think it will. It's uncertain how long that will be. There are a few folks that have gone through the disease and apparently not got the immunity, and we know that sometimes happens. There are folks that do get the immunity. It's just too early to tell. Is that immunity going to be with you for life or for a few years? We'll sort that out over time, but so far that's unknown.
What can you speak to, Nikki, about wearing masks or cloth face coverings when you're out in public making those essential trips?
So it is the CDC recommendation that when going out and making some of those essential trips for groceries, for example, that the members of the public should wear a cloth face covering. That can be a homemade mask. It could just be a scarf. It could be a t-shirt, a bandana, whatever you have that you could use to cover your face. You don't need anything fancy. You don't need any sewing skills. But to have something covering your face is something that is recommended by the CDC, and that is more to protect others from you as opposed to protect you. So that helps keep your droplets in and not from spreading. It's not perfect, but it absolutely reduces that. Just in case you happen to be an asymptomatic spreader, we know there are people out there that have the disease, never experienced symptoms, and could unknowingly be out there spreading it to others. So that's where that recommendation comes from.
And then lastly, if people want to help out or donate to this cause, how can they go about doing that?
Yeah, I think there's a couple of mechanisms. So the United Way of Southwest Michigan is collecting donations for our Emergency Operations Center, including the health department. So there are a list of items that we have requested that we can use as we continue to serve vulnerable populations. It includes things like hygiene, cleaning products, definitely any PPE, personal protective equipment that people have, hand sanitizer, but also potentially socks, underwear, hygiene packets, scrubs for people who might be displaced in an isolation or quarantine facility due to their living situations and COVID-19 status. And I think Spectrum Health Lakeland is accepting donations as well.
We are as well, and have a number of folks doing that with us.
Okay.
All right, well, thank you so much for joining us. We really appreciate you taking the time to hear what's been going on with our organizations and with the broader community effort here. We appreciate being able to keep you informed with credible information about what is going on. You can contact us through Facebook on the Berrien County Health Department or Spectrum Health Lakeland's Facebook page. The health department also has a hotline where we are answering questions during business hours. It's 1-800-815-5485. And we look forward to seeing you again soon.
Thanks, folks.